Venlafaxine, an informative presentation by Charlotte Stevens. This is a presentation based on the drug venlafaxine that I'm presenting to my patient, Mrs. Scholl. The teaching method I'm using is an oral presentation. Mrs. Scholl is a 34-year-old woman who is suffering from depression and has been prescribed venlafaxine by her doctors to help her control it. My learning outcomes are that Mrs. Scholl will know all of the necessary information to take venlafaxine. Mrs. Scholl needs to know how to maintain her health and well-being while on this drug. Venlafaxine belongs to a group of medicines called serotonin noradrenaline reuptake inhibitors, or SNRIs, as most commonly known. Venlafaxine increases the level of serotonin and noradrenaline in the brain, helping to restore your feeling of wellness. Venlafaxine works by increasing serotonin levels, norepinephrine, and dopamine in the brain by blocking transport proteins and stopping their reuptake in the presynaptic terminal. This action leads to more transmitters available at the synapse and ultimately increases the stimulation of postsynaptic receptors. SNRIs act primarily upon serogenic and noradrenergic neurons, but have little or no effect upon cholinergic or histamogenic receptors. So who is this drug made for? This drug is specifically targeted for people suffering from depression. However, it has also proved effective for people who suffer from panic disorder, generalized anxiety disorder, and social phobia. Venlafaxine can interact with other medications, vitamins, or herbs. Concurrent use of these agents can cause dangerous effects and are contradicted with venlafaxine. The following is a brief list of interactions with venlafaxine. Patients should not take venlafaxine with monoamine oxide inhibitors, MAOIs, linezolid, and methane blue. Caution is necessary when using venlafaxine with drugs that can increase serotonin levels, including SSRIs, SNRIs, and triamidol, as they can lead to life-threatening serotonin syndrome. Venlafaxine should not be combined with drugs for weight loss, such as phentermine. Using venlafaxine with drugs like phentermine may result in excessive weight loss, serotonin syndrome, and heart problems such as tachycardia and hypertension. Venlafaxine taken with warfarin and anti-inflammatory drugs such as aspirin, ibuprofen, naproxen, which are NSAIDs, increase the risk of bleeding. Metoprolol may also be less effective with venlafaxine. If you have any questions or concerns or want to inquire about any medications that you're currently on, in case you're worried, then we can either have a chat with you and me, or we could talk to your doctor about it. So in terms of adverse effects of taking venlafaxine, there are a few different categories. So the first one is common, so more than 1% of users that take venlafaxine will feel some of these symptoms, which is nausea, dry mouth, constipation, yawning, sweating, dizziness, and increased blood pressure, weakness, sexual dysfunction, example impotence, a decreased libido, somnolence, insomnia, headache, blurred vision, mydriasis, a tremor, a decreased appetite, or a rash. And then you've got infrequent, which is 0.1 to 1% of users will feel these, orthostatic hypertension and fainting, palpitations, tachycardia, abnormal liver function, and hypertremia, and that usually occurs early in the treatment as a part of SIDAH. And then the rare, which is less than 0.1% of people will, have these, but seizures, axia, stress-induced cardiomyopathy, hyperglycemia, and for example, galactorrhea. If you have any concerns about these, or you're suffering with something like hypertension already and you're a bit worried, we can have more of a conversation based on that with either just you or me and your doctor again. But yeah. In terms of dosages, the regular adult dose is orally 75 milligrams once daily. This is the starting dose that the doctor has prescribed for you, Mrs. Scholl, and it'll be a bit of a trial period to see if this works for you or if you need more. So if required after a trial period, the doctors will increase you to 150 milligrams once daily. Although most people do respond to doses of 150 milligrams daily or less, doses up to 225 milligrams daily may be needed in some cases. But again, this is something that will be dealt with and initiated by the doctors based on how you're feeling. Little is known about efficiency and safety of doses above 225 milligrams daily, so your dosage will never become more than that. Most of your dosaging questions will be something to talk about with a doctor, but if you ever need to talk about anything, just let me know.